Hello, and welcome to the recording of anti-blemish solutions, including Blemiderm. So today we're going to predominantly talking about the different grades of acne, what we have to offer at Mesoestetic in relation to retail and in-clinic procedures. Obviously, we're going to be looking at the different manifestations of acne because it can go from very mild to extreme. So acne vulgaris is a skin inflammatory disease that affects the pilar sebaceous unit. So the pilar sebaceous unit is basically where our hair follicle sits, and in there we have our sebaceous gland. 9.4% of the world's population is affected by some form of acne. It's the eighth disease in the world, third skin disease in Europe, and first skin disease in Spain in winter. So it can appear at any age. I know this is something that we tend to think about when we're teenagers, but you can get acne as an adult as well. So just a few factors there. So newborn and breastfed babies can actually experience some form of acne. Youth, which we know is most frequent, and then obviously adult, especially frequent in women, continuous of prior acne. So someone like myself, I did have acne as a teenager, and now I'm older, I occasionally still get acne. So it is quite common. It has an impact on the patient. So we know it has a physical impact, a social impact, and obviously we know it has that psycho-emotional impact as well. So here at Mesoaesthetic, what we do is we're putting acne generally into two different categories. We know there's more than two categories, but when it comes to things like the retail and the in-clinic procedures, we want to know, is the client acne prone, or are they suffering with active acne? So when it comes to acne prone, it could be a combination skin. So it means you could have someone who doesn't have much oil, but they do get the occasional spot, or they could be very oily and again get the occasional spot. Thickened or irregular texture could be an acne prone skin. You could see enlarged pores and occurrence of localized and temporary acne lesions. Okay, so it could be that there's certain points throughout the year, certain points throughout the month, certain factors that influence whether or not that client sees any kind of papules, pustules, congestion, and so forth appearing. Whereas active acne generally is with an oily skin, not always the way. Someone like myself who's got active acne, I don't have oily skin. So I have a relatively dry, dehydrated skin naturally, but I get inflammatory acne. So this could still be categorized as someone with active acne. So this is a seborrheic skin. Thickened and irregular texture again, dilated and visible pores, presence of inflammatory or non-inflammatory acne lesions, frequent and consistent breakouts. So this is going to be someone who might have it all over their face. It might be that it's localized to certain areas. It could be that they have 4 or 5 spots going on at any given time, 4 go, and then another 3 pop up at the same time. So it's consistent. So when we're looking at acne vulgaris, we've got to kind of put it into kind of like a category or a grading system. So we've got non-inflammatory and inflammatory. We've then got blackheads, papules, pustules, nodules, and cysts. So the target scope of what we're looking at is kind of from blackheads up into nodules. Okay. Post acne, we see a lot of scarring, post inflammatory hyperpigmentation, and post inflammatory erythema. What we don't want to be treating is someone with fistular acne. So Over the years, we know that when it comes to things like technology, advances in skin, we're going to know more as time goes on. So what we've done is look at the latest scientific evidence, okay? So we've gone to things like dermatological congresses, we've found out key information as to why someone is suffering with acne. And this is really important. I always think about acne and hyperpigmentation at a similar level because unless we find out what's triggering it, it can be very difficult to treat and very difficult to manage. So we have to have those conversations in consultation with our client because it could be that it's something that they have control of. It could be something that they could just make that slight change and it will help their skin. So we have to have those conversations because if the client is, you know, assisting, if the client is compliant and they're willing to make changes if they can, then obviously these products and these treatments will only work better. So things like what we call the exposome. So it could be things like diet, dairy products stimulate the main acne pathway. So some people that suffer from forms of dairy or lactose intolerant, it may not always affect their actual gut. It could be that, well, it does affect their gut, but what we mean by that is they're not suffering from things like IBS and so forth. It's more so that it's affecting their skin. Things like hypertoxicity. So 15% of patients on oral isotretinoin report it. Gut skin. So again, going back to the gut microbiota is related to skin balance through its influence on the immune system. So it could be other things that are being eaten. Over the years, we've heard things about sugars and so forth. So actually what we're eating can have a massive impact on what affects our skin. And then other adverse effects, isotretinoin is one of the 5 drugs most associated with neuropsychiatric problems. Okay, so we've got to look at our clientele. Okay, we've got to look at what people are taking medication wise on a day-to-day basis, because all of these things may contribute as to why it could be all of a sudden that they are experiencing the acne. And now some things we can change. Okay, we might, the clients might be able to adjust diet, but we can't with everything. So mechanisms of action. So the Blemiderm acts comprehensively on the different pathways that cause blemishes and offers a multilateral approach at the cellular origin. Okay, so we're going back to the origin. So it could be things like we're dealing with hormonal acne. Okay, so hyperseborrhea, dyseborrhea, hyperkeratinization, could be bacterial proliferation, so things like infection, could be inflammation. So again, seeing things like the hyperseborrhea and also that hyperkeratinization. So we can see here what it is that needs regulating. So the physiopathology of acne, okay, so we're looking at hormones, we're looking at those hormonal pathways, we're looking at exosomes, so things like medication, diet, so forth, and we're looking at the imbalance of the skin bacterial flora, okay, so inflammation. So excess sebum production and change in sebum composition. So we see thickening of the skin, we see inflammation, and we see bacterial colonization as well. So first of all, we're going to be looking at home care because everything should start with home care. Okay, we want to make sure that the client is using the correct products for their skin and the correct products for the type of acne that they have. So we're going to be looking at our 2 different kits, our acne prone kit and our active acne kit. Now, all of these products are sold separately. You can kind of tweak them if you need to. And then there are additional products that are not in the kit that you can also sell to your clients. So first of all, we're going to look at the acne prone skin kit. Now, what's nice about this kit is, if someone just has the occasional breakout, it's quite a small area, or you just have someone who has very oily skin, essentially, I think we tend to forget about that type of skin. I've seen many clients over the years where they've never had acne. And it's surprising because they have very oily skin. But it could be that they do look after their skin, but they're just struggling with that excess oil. So they could use the acne prone kit for that as well. So we've got 4 products. We're going to go through them in detail. So we've got Purify Mousse, Blemiderm Resurfacing Gel, the Hydrovital Light Moisturizer, and from our SPF range, we have chosen the Mesoprotec Water Bow. And what's nice here, you'll get this little print, this printed out on a card, and it comes within the bag that the kit comes in. So even though you'll explain to your client how they need to use these products on a day-to-day basis, the little card will be in there to remind them. So Purify Mousse is a lovely cleanser that they'll use morning and evening. They can use it twice in the evening, once to remove their foundation and then the second time to obviously cleanse their skin. Please tell them to avoid the eye area. It is quite strong, so they will need to use a separate eye makeup remover. We have chlorhexidine in there, so this has an antiseptic approach. Salicylic acid, so it's going to cut through that oil, clear everything out, munch away at those dead skin cells, and also open the door, open the pathway to those other ingredients. And then we have lactic acid. So we know that it's anti-inflammatory, it has a refining action, and it's also incredibly hydrating and moisturizing. This product also smells of menthol. So it's a lovely fresh smell. The client will apply a couple of pumps or a pump and a half, and they can either apply it to damp skin or dry skin, whatever works for them, massaging it in, thoroughly cleansing the skin. And then they have 2 options. They can either splash their face with water to thoroughly remove it, then pat dry, or use a clean face cloth with cool water or lukewarm water to remove. Now, just some additional advice. When we are using face cloths at home, it could be flannels, it could be mitts. If someone is suffering from acne, please advise one use. Okay, so as a company, we currently sell these little black sponges. They're amazing. I use them myself every evening to cleanse my face and thoroughly remove my makeup. But that's the only time I use them. They then go in the washing machine. Okay, so we do see it quite often where people do have quite a lot of face cloths. That's great. Just use them once, because if people get into the habit of leaving that wet cloth on the side in the bathroom and they're not going to use it again for 24 hours for the following evening, and then they go back to it, it could build up bacteria. Okay, so face cloths are great. I wouldn't live without them, especially when I'm using something like a pre-cleanse or I need to remove my makeup, but one use. Okay, then wash them. So we then have the Blemiderm Resurfacing Gel. Now, it's really important that your client is using this nighttime only because it has active ingredients. So what your client will do is after they wash their face with the Purifying Mousse, they will pat dry, and it says apply 1 pump and massage into the area. Okay, so massage into the whole face. Okay, and then leave it for a couple of minutes to absorb because it is a little bit tacky. Okay, so it contains 10% glycolic acid, which we know long term, really good for things like helping acne, really good for acne scarring, but also anti-aging, which we all want. 2% salicylic acid, and then we also have a gentle natural exfoliator in there that also helps to moisturize. Okay, now this product can be a little bit spicy for some. So yes, it's nighttime only, but please remember, as with all active products, some clients need to acclimatize. Okay, it's dependent on what they've previously used. If a client's never used acids, they will need to acclimatize. If they've never used glycolic or salicylic, they will need to acclimatize. So you might want to start off 3 times a week or every other night, and then slowly build up to using it every night. It is common for clients to experience a little bit of dryness, a little bit of flaking from an active product. We then have the Hydrovital Light Moisturizer. Now, I absolutely love this moisturizer. It's one of my go-tos because I like to feel like my skin is moisturized, but I don't want anything too heavy, especially in the day. So this particular product, they would apply 1 pump of it and massage it into their skin in the morning. So when they cleanse their skin with a purifying mousse, pat dry, 1 pump of this, completely massage it in, let it absorb. But then they can also use it at night after they've used their gel serum. So what they would do is wait for that to absorb, like I said, a few minutes, with the resurfacing gel, and then a pump of Hydrovital, massage that in, leave it to absorb, and then they can go to bed. So this particular product has the HA dense matrix complex in it. So it has several molecule weights of hyaluronic acid. So one that sits in the top layer, one that sits in the dermis, and then different weights of HA that will sit in every layer of the epidermis. Okay, so we're hydrating completely throughout, which is key. We then have excuse me, our anti-pollution or antioxidant urban detox. So this is in a lot of our cleansers. It's a plant-based ingredient that basically helps protect the skin from contaminating particles. So things like pollution, dirt, and so forth. And then we've got a plant-based polysaccharide in there that stimulates the main genes involved in the formulation of molecules, making up the barrier function to prevent dehydration. And then lastly, the SPF we've chose is the Waterval SPF 50 plus. So this protects against UVA, UVB, HEV, which is blue light, and infrared. So all our SPFs, they need to give them a really good shake before they use them. And then they want to apply around 2 mils per centimetre square. And they should be doing this every 2 hours when exposed to damaging rays. So it's a physical, so they'll get instant protection. We have a Collagen Pro 47 plant extract in there that helps to increase the presence of high quality collagen in the skin. We have hyaluronic acid in there, so it makes the texture ultra light. Okay, so it does absorb really well. So an acne skin, tends to prefer that. And obviously it's water resistant, not waterproof, and dermatologically tested. We then have the active acne skin kit. Okay, so two of the products are the same. We still have the purifying mousse and the client will use it in the exact same way. And then we also have the SPF, but it's the two products in the middle that are different. So I won't go for the purifying mousse with you again. You understand that. The active product in this kit is the Blemiderm treatment cream. So this is going to be used the same way as the Blemiderm resurfacing gel, but obviously it would be this product. So again, at night after cleansing, one pump, massage it in, leave it to absorb before then applying the hydrator. Okay, so this contains retinol. We know the multitude of benefits from using retinol. It contains 2% salicylic acid and it also contains shikimic acid. Now, this is from the Japanese star anise, which is a plant, and it's anti-inflammatory and sebum regulating. So then we have a concentrate called Skin Balance from our Sensitive Skin Solution. So this product's going to be used morning and evening. So in the morning, after cleansing and patting dry, you'll need around 3 drops, massage it into the whole face and let it absorb before applying the SPF. And then at night, when they've used their Blemiderm treatment cream, let that absorb and then obviously apply the Skin Balance. Again, with the Blemiderm treatment cream, they will need to acclimatise to it again because it is strong. So again, if you've got a client that hasn't used anything like that before, introduce it slowly. So when they are using that, 3 drops of Skin Balance, massage it in, and then they will go to bed. But let it absorb. Again, it's a little bit tacky. So it has a biobalancing action, anti-pollution, antioxidant action, and a calming effect. Now, it contains an ingredient called Rhodosaurus marinus, which sounds like a dinosaur, but it's not. It's actually a red algae from the sea. So this is an anti-inflammatory and it has kind of like a resistance response. So what it's doing is stopping the sensation from the nerve ending to the site of pain, almost like a numbing effect, but it doesn't numb the skin. You've got panthenol from provitamin B5 in there, so indicated to soothe and prevent irritation, scaling, and redness. Flower of saffron extract to soothe and have anti-redness. And aloe and calendula extract, known for their moisturizing and regenerating properties. And then finally, the Waterval, which will be used in the exact same way as if they were using the acne prone kit. In addition to that, we do have other products that you can introduce to your client if you feel that it's necessary. So again, we're looking at that sort of gut to skin pathway. So new scientific evidence shows that an imbalance of the gut microbiota leads to the development of acne. Okay, so depending on diet, medication, and so forth, leads to that inflammatory process. So external factors promote inflammatory processes that activate acne, causing cellular mechanisms. So we have the Blemiderm caps, and I take these, and I think they're fantastic, and no one can stop me from taking them. So these are really, really good. These have three strains of probiotics, prebiotics, and biotin. Okay, so you can see there the three strains of probiotic. You've got inulin with the prebiotic. So again, working on the intestinal tract. You've got biotin to stimulate the action of essential enzymes in cell duplication. And then you have zinc, which we know is an anti-inflammatory, antibacterial, and regulates the production of sebum. So you get 60 capsules. So you've got 2 months worth there. Clients tend to see results around the week 3, week 4, but obviously that's client dependent. So what's nice there is once they start to see the result, they've still got a lot of capsules left to continue their program. So one capsule per day with a glass of water in the morning. Okay, so sufficient amount for 2 months of treatment. We have Blemiderm local control. So this is quite a small bottle, and this is for someone that gets the odd spot. Okay, could be monthly. Okay, it could be that when they're going through their cycle, they get a big one come up on their chin. So this is a great product to keep in your handbag. It can be used in the morning. However, we do advise that it is used nighttime only. It has AHAs and BHAs in there. So it's got mandelic, glycolic, and salicylic. So it's one of those things where you'd wash your face, pat it dry. What I would generally do is using a cotton bud, squirt a small amount onto the cotton bud and apply it very locally to the area, dab it in, wait for a few minutes for it to absorb, and then I could put my moisturizer on top, or I could just leave my skin. But again, you can see you've got things like niacinamide in there, helps to prevent the appearance of post-inflammatory hyperpigmentation, and you've got other plant extracts in there as well that are going to help with regulation as well. We have pure renewing mask. So pure renewing mask can be used once or twice a week. They can use it at night. So after they cleanse their skin, pat it dry, apply a nice thin layer. Leave it on for around 15 minutes. And then what's nice about this product, it's multi-use. It can actually double up as a scrub because it has little cellulose particles that are biodegradable. And once the 15 minutes is up, they can give their skin a little bit of a scrub. And then we do recommend that they use a face cloth to get the majority of the product off, and then they can splash their face with lukewarm water. So you've got kaolin in there, which is a white clay, has a purifying action. Salicylic, mandelic, and azelaic acid. So we're going to be working to regulate that sebum, have that antibacterial effect, and also anti-inflammatory. And as I've said, you've got the cellulose particles in there for that physical exfoliation. In addition to that, we also sell this product in a professional size. So if you're doing a facial, okay, in clinic, not a peel or microneedling or anything like that, but just a general facial, and you're looking for a nice purifying mask to use within that facial, we also have the professional size in 500 mils. Blemiderm. Okay, so when it comes to the Blemiderm process, this is something that may not be for everyone. Okay, most of you would be trained in our meso peels. You know that we have the Blemi skin with the white lid, and then we have the Blemi skin MD. So it could be that would be their starting point, maybe. It's entirely up to you. You can just go straight into Blemiderm. You could have your client on the active acne kit for a few weeks, and when you felt that they were ready, they could come in and have their Blemiderm and have their 3 treatments. Or you can take a more progressive approach. You could do maybe like a pre-peel, do the Blemi skin with the white lid or the Blemi skin MD, wait a couple of weeks, and then maybe do their Blemiderm treatment. So it's entirely up to you. But this is going to be more for your kind of moderate to severe acne. And what's nice is at the end here, we're going to look at some of the before and after photos. So you can see the examples of people who were suitable for the procedure. Okay, so enhancement in the consultation protocol. So intensive correction of imperfections in 2 phases. Innovation of formulas, so highly effective active ingredients. We now have a new conduction system, so we're now using transvasomes. Scientific proof, clinical efficacy with in vitro and ex vivo study. And obviously our home method, the pack includes home treatment to ensure continuous process. So the kit also contains an additional purifying mousse and an additional Blemiderm treatment cream. Okay, so when your clients run out of the ones in their kit, you've got two products to replace it. Okay. I advanced. So when it comes to the professional treatment, you are going to do kind of two peels on the same day. You're going to do a pre-peel, and then after that, you're going to apply the Blemiderm mask, which is obviously a peel as well. And then you've got your neutralizer there. So the Blemiderm pre-peel has a keratolytic and sebum regulating kind of action, decreases hyperkeratinization, unblocking the pores and allowing active ingredients to penetrate in. Elimination of excess sebum and I can never say this word, seborrheic. There you go, I said it. Stimulation of cell renewal and synthesis of collagen and elastin. So you get three of these, okay? Because obviously you're going to do three treatments, which is what's in the pack, 2 weeks apart. Really strong ingredients in there. So we've got some retinol, okay, which is very strong. Bakuchiol, which is a plant-based retinol. Salicylic, mandelic, phytic, glycolic, caffeic, and succinic acid. So this gets hot, guys. Okay, so please make sure that your client has a fan. If anything, I'd have an electric fan. Okay, very, very warm, very, very tingly. But what's nice there, you can see what it's targeting in relation to like each ingredient for hyperkeratinization and seborrheic regulation. So the better that time. So we'll go through protocol, but this stays on the skin for 5 minutes, and you would, you'd apply it with small rough gauze. No pressure, just get it on. Leave it for 5 minutes, thoroughly remove it, okay? And then we have post-peel neutralizing spray. Now, this is just sodium bicarbonate and aloe vera. You don't have to use this after the pre-peel, but if you feel it's necessary because of the stimulation, okay, you can neutralize that pre-peel once you've removed it. However, it's extremely important that you wait for the pH to naturally go back to what it was before then applying the Blemiderm mask. Okay, so you don't have to use this after the pre-peel. But if you do, you might need to wait a good 10 minutes, okay, for the skin to go back to its more natural pH. You might even push it to 15 minutes, okay? I'm someone who experienced this treatment. I did it on myself. Yes, I did it on myself. And I immediately neutralized because I did find it quite hot. And then I immediately applied the Blemiderm mask. And I did get an overreaction, okay? So if you guys ever want to see my photos of my overreaction, I'm more than happy to send them to you, but I didn't wait. I didn't wait for that pH to regulate. So we do need to make sure that we do that. But like I said, you don't need to use the neutralizer. You just need to thoroughly remove the pre-peel. So then we would go in with the Blemiderm mask, which we apply to the skin, a nice thin layer all over with a spatula. And this stays on for 10 minutes. So it's double the time of the pre-peel, okay? So we have something in there called the Blemiderm complex, which I'm going to go through with you. Pyruvic acid, which is really spicy, mandelic, salicylic, shikimic acid, kaolin, and sulfur. So it's a little bit smelly, okay? So pre-warn your clients. But again, with each of these ingredients, we're seeing what we're working on, okay? So you've got the little ticks there for each of those ingredients. So that would stay on for 10 minutes. You would remove it and then thoroughly neutralize at the end. But you're going to see the protocol anyway. So the Blemiderm complex is a delivery system through transosomes, which I'll go through with you. So you've got 3 ingredients there, and these are working as an anti-inflammatory, antioxidant, antibacterial, and that SIBO regulation, cell renewal. Okay, so we've got control of the 5A reductase pathway. Okay, so this is the regulation of the hyperkeratinization. Autophagy, which is speeding up cell renewal. Control of the IGF-1 pathway. Regulation of cell proliferation, and that anti-inflammatory action. So transversomes. So when I first started out as a therapist many years ago, it was all about liposomes, okay? All about liposomes. Yeah, these really small molecules where it's almost like an encapsulated process where we get everything into the skin. Over the years, then we came across nanosomes, a little bit smaller. Now we're dealing with transposomes. So we've advanced a lot. Okay. So this is basically, you know, what it's like an encapsulation size that's taking it into the skin. Okay. So action directed at the pilosebaceous unit. Okay. So from its origin, sustained release system enhances the absorption of these active ingredients. So this is really nice, the Blemiderm formulas, combination of active ingredients in the range. So these are obviously some of the ingredients that we've looked at already and what they're actually doing. So you've got your sections there where we have your sebum regulation, your skin renewal, your antibacterial action, your anti-inflammatory action, and then obviously you've got hormonal control. And also at the end there with the Blemiderm catch, you've got your bacterial rebalance. So that's really important with your pre and probiotics. So, this is the protocol. I've briefly spoken about it. Okay, you would have been most likely trained already, or you're just looking at this video and thinking, I want to get Blemiderm in. Obviously, we will train you in it, either face to face or online. All the protocols, though, can be found on our professional zone. So, our professional zone is through our website. If you haven't registered, please register. You need to be an existing account, so you need to have done your opening order with us to be able to be accepted on the professional zone. So if you are new to us and you haven't done your order yet, don't worry. Once you do, you will have access to the professional zone, and all of the protocols can be found on there. And it's a step-by-step process, guys, and tells you exactly how to perform each treatment, including this Blemiderm procedure. So just a few things to talk about, which, are predictable. The skin's reactions could be things like, irritate, tolerable. It's not like, continuous, but there might be some itching, mild erythema, and white deposits. So this isn't frosting. This is like a crystallization of active substances. Okay. So I got it where it was like a faint powdery effect. It's not true frosting. Okay. But the mask must be removed before the recommended 10 minutes, okay, if the following skin reactions are observed. So moderate to severe erythema. All right, we need to take into consideration that some people go a lot more red than others. So make sure you take that into consideration because you don't want to remove it if you don't need to. But if you're thinking, you know what, this is a little bit redder than I thought it would be, I'm going to remove it. And then obviously frosting. Now, I don't think this is a good picture of frosting. For those of you that know what frosting is, you get that kind of like block frost, white layer, that doesn't remove with damp gauze. So you can always test it. If you think it's a block frost, get wet damp gauze and just wipe that area. You don't have to straight away wipe the whole face, but just wipe that area. If it comes off, it's more likely that it's going to be crystallization. But if it's looking like frosting, it won't. So you need to get it off quickly as possible and get it off, neutralize the skin, crystal fiber mask, fast skin repair, and then just follow our general post procedure guidelines for any form of reaction like this. So you can add in other products they may essentially not have post-procedure to calm the skin. It's going to help with sensitivity. It's going to help with any peeling. So if a client has erythema, they can purchase the anti-stress mask. This is a lovely, lovely mask, nice thin layer. They can either leave it on for 15, 20 minutes and remove it, but it's also really nice to sleep in. And then we encourage all of our clinics to give every single client a fast skin repair as part of their package. Okay, so whether you're doing peels, you're doing microneedling, it just should be part of it. Because after a procedure such as this, they're not going to be using their actives. Okay. So it could be a few days, it could be a week or so, depending on how long it takes for their skin to recover. It's completely normal to be a few days to a week or so because everyone's skin is different. But to have something like fast skin repair that will help the skin repair and recover more quickly is imperative. And if they're on the active acne kit, which they most likely are, they'll have the skin balance anyway. So this is just looking at the complete treatment cycle. So session one on day zero, session two, 2 weeks later, session three, 2 weeks after that. And then obviously you can get them in 2 weeks later for another review. Three Blemiderm treatments in total. One, it says every 15 days, but every 2 weeks is fine. And obviously prepare the skin for a minimum of 2 weeks with the active acne kit prior to their first Blemiderm treatment. So other things to consider, can they be combined with other treatments? So we've got it listed, okay? So with the Blemiderm caps, yep, absolutely fine. Generally with antibiotics, topical, oral, hormonal therapy, oral retinoids, Blemiderm caps are absolutely fine. If they are on either antibiotics, topical or oral, or hormone therapy, yep, absolutely fine. Just obviously make sure they're using their Blemiderm treatment at home at night, which you will anyway. You'll never use it in the morning. But if someone's on an oral retinoid, it would be no. Okay, so it'd be no to the Blemiderm mask and generally the Blemiderm treatment. Okay, but they can use the Blemiderm caps. So we've got some before and afters here. So these first ones are from Spain. Yep, around. Um, really nice result there. And these are from one of our clinics. So absolutely. So you can see the type of skin that a Blemiderm is suitable for. And that's it. So when it comes to things like adversity or it comes to things like adverse reaction, obviously we want to help you as much as we possibly can, but you need to help us first. So if you do have any kind of adverse reaction, the first thing we state before you even contact us is you need to tell your client immediately to stop the use of any active products. Anything with acids in, anything that's active, they need to stop immediately. And then use any products from, say, our sensitive skin range. Okay, so that's things like fast skin repair, Hydro Cream Fusion, Melan Recovery, Skin Balance, anything like that is absolutely fine. And then when you contact us, we're going to need all of the information. So if you contact us by email, you can send us, we need a full copy of their consultation form and consent form. We need a full, all their photos that you've taken. So not just their adverse reaction, we need all their pre and post treatment photos as well. And then we do have a form that's called the undesirable effects form, which can be found on our professional zone. We need that filled in and sent over to us. So once we've received all of that information, we can have a little look at it and then we can get back to you. But it's really, really important that you are telling your client before you even contact us, the first point of call, if it's an adverse reaction, is they need to stop the use of all actives immediately. So this, I mean, we're open Monday to Friday. So if you get the call that the adverse reaction is a Friday evening, you may not hear from us until Monday. So it's important for the next few days you understand what your client needs to do. Okay, so then when you get to us on Monday, we know that the client has been taking the correct steps to obviously prevent it getting any worse. So, thank you for joining me today on our anti-blemish solutions featuring Blemiderm. Um, Please contact us. If you have any questions, you can email contact@mesoestetic.co.uk. You can find out about anything else that we have to offer, not just acne related, but also with other procedures that we have to offer as well. And please follow us on social media on things like Facebook, Instagram. We have some fantastic photos, before and after photos, of what our clinics put up with their clients. So yeah, it's a really, really good way to kind of introduce these procedures to your clients because they can see that members of the public are having things like Blemiderm. Thank you.